Good morning, everyone. We have today a couple of announcements and a general update about the city's efforts to stem the spread of the coronavirus. I'm here today with the chair of the New Bedford Board of Health, Dr. Tricia Andrade, along with our health director, Damone Chaplin. Also in attendance are our police and fire chiefs, Joe Cordero and Paul Cordair, respectively. So let me just say a few words about where we are, what we're doing, and then talk about something specific that we're doing to protect seniors and other vulnerable folks in Greater New Bedford. So while the spread of the disease in Greater New Bedford fortunately has lagged behind major metropolitan areas like Boston and New York, we have seen already that cases are ticking up. Just in the last 6 days, the city has gone from 6 confirmed cases to 33. Around Greater New Bedford, we're also seeing an uptick as well. So in addition to New Bedford, in our suburbs, Freetown has 2 confirmed cases, Fairhaven 12, Acushnet 0, Marion 1, Rochester 0, Mattapoisett 1, and we do not know the numbers from the town of Dartmouth, at least not recent numbers. So what it means is that, as we've fully expected, the numbers are coming up. That's in part attributable to the greater availability of testing, of course, and that's a good thing because it'll enable us to better track the path of the virus. We're doing considerable contact tracing through the health department right now. But tests remain, the number of tests available, test kits available to us in the region still remain woefully inadequate, just by way of example. So together, Hawthorne Medical and the Greater New Bedford Community Health Center have about 200 test kits available to them. A little more alarmingly, South Coast Health right now only has 140 test kits. South Coast Health is the default provider in a region with a population of about 450,000 people. So it isn't nearly enough. And so any broad conclusions that we try to draw about the rate of the reproduction of the virus here are only just vague estimations. We really have to understand that more testing is needed so that we gain a better window into what's happening. We do know that the virus is here and it is spreading, so we need now more than ever to stick with the social distancing that residents of our city have been doing very well. The police have been enforcing it. They haven't had to enforce on many occasions because people have been very, very compliant here, and we just need to keep that up. And the objective, of course, is to slow the rate of the spread of disease, and eventually more people will pick up immunity, and we'll start to see the cases drop. We're nowhere near that point right now, and so we just need to know that we've got to stick with it, and we can take some confidence in the knowledge that the better that we do now at social distancing, the sooner we'll get back to normal. So I continue to encourage everybody, just to stick with what you're doing, as difficult as it is. And we can talk later if you have questions about some of the other social distancing measures, that we've undertaken. But we're still fighting. We're fighting this thing on a number of fronts, and I'll just tick through those things right now. So we're working very closely with South Coast Health and the other providers in the region to prepare for a higher volume of patients than they're getting in right now, of course. And so that's, I think in the next few days we'll have some more announcements to come. Our teachers are providing remote instruction to our students so they can have meaningful learning opportunities despite the disruption in their formal education. They're working very hard right now on that. Our city employees, meanwhile, continue to provide services to our residents. They're doing it remotely. It's harder to manage all of that remotely, but they're really making do, and they're adopting some of the new technologies, like things like Zoom and GoToMeeting and other apps that will facilitate what they do. It's not perfect, but they're working hard. And as you can see around the city, there are lots of folks who are out working on public works projects right now and continuing to move things along. And we're working very closely with our federal and state authorities to ensure that our businesses and folks who have lost their jobs are able to get the assistance they need. There's a lot more to come on that. So today I wanted to talk specifically about a key facet of our efforts, and that's to protect our elderly. We by now I think all of us are familiar with the one characterization of the disease, and that is that the elderly and those with underlying conditions, those who are immunocompromised for one reason or another, are especially vulnerable to contracting this highly contagious disease. And we have seen in various places around the country, most prominently in Kirkland, Washington, and most recently in Holyoke, Massachusetts, the devastation that can be wrought when a virus is led into a senior facility. And so, we want to make sure we're doing everything that we can to protect our seniors. Of course, most seniors don't live in facilities of any sort. Most are out and about in their own homes. We do continue to encourage them to stay right at home, to avail themselves of programs like Meals on Wheels, to ask for assistance in getting groceries and other needed supplies. I've seen that kind of support happening all over the place. That's a good thing. People should keep that up. But for those who are living in nursing homes, senior living facility, long-term care facilities, and senior residential facilities, we have to be especially on it. We're not aware as yet of any positive cases in any of these facilities, and it's our job to make sure that these places are buttoned up so that the virus doesn't get in. It's as plain and simple as that. Most of the facilities managers around the city, if not all of them, frankly, are doing a very responsible and thoughtful job in protecting their residents. In city government, we just feel very strongly, I feel very strongly, that we have to do everything we can to keep those places sealed up. Because there really is very little margin for error in that way. And so we're announcing today 2 orders jointly issued by me and the Department of Health, the Board of Health, that will go a long way in conveying to everybody, including those who manage these facilities, that we really have to be on our game. And so I think you all have copies of these orders, but the first one concerns senior living facilities of every sort: nursing homes, long-term care facilities, and senior residential facilities. And it essentially lays out a set of requirements to ensure that the virus is not let in and doesn't spread if God forbid it is let in. And so, among other things, there are requirements concerning the cleanliness of the facilities, curbs on visitation and group activities and communal dining, check-ins of every sort, knocks on the door, calls to residents, among others, and wellness checks by medical professionals. We have many of these facilities around the city. This is a real soft spot for New Bedford in the sense that our population skews elderly, so we have to really be on top of this thing. And so we're going to make sure that everybody's screened going in, and that there's very little in the way of activity except for everything that is essential: food, medical support, and that's pretty much it, which is an imposition on our senior residents, in the sense that loneliness is a tough thing for anybody. It's especially tough if you are older, and so we have to do everything we can to ensure that our senior folks our seniors living in these facilities are as comfortable as they can. But circumstances dictate that these places really do have to be walled off, and we'll be enforcing this under the emergency order that I issued a couple of weeks ago. we will make sure that in the event that we encounter noncompliance with this order, that we will follow up on it, and warnings will be issued. And if those warnings are not heeded, then we'll have to do more, and that includes fining facilities $500 a day per violation. We'd rather not get to that point, but we can't mess around with this. We really can't. And so advisories or, pleas to everyone's pleas to reason are important, but we have to go further than that. We really have to make sure that all of these facilities are doing everything they can to protect their residents. We expect them to, but we're also going to, we will trust but verify under the circumstances. There is a second order that's being issued today in a similar vein concerning group homes, lodging facilities that take in folks on a part-time basis. Many of these places take in folks who have substance abuse issues or are otherwise transient. And we want to make sure that these facilities likewise do not pose health risks. And so a number of the same preventative measures will be in place with respect to these facilities as well. They have to be managed much more closely. And so for the owners of these facilities, we say to you, you really have to keep a close eye on it. We're going to be inspecting. And if you don't think you can monitor folks who are coming into these facilities for their temperature or their general symptoms, any symptoms that manifest themselves as COVID related, you really can't let those people in, and we're going to be sure that we're going to make sure that that's complied with. So in the next couple of weeks, starting right away until as long as necessary, our health department, along with others in city government, will be making sure that we have strict compliance with these orders. These are really necessary. We part of what we do here is both carrot and stick. But the stick in this particular instance, given the heightened vulnerability of these populations, is entirely fitting and appropriate, we believe. So I want to thank the Board of Health for unanimously passing these measures. I want to thank our health department for its anticipated enforcement of them, and I ask everybody to step up. When it comes to our seniors, there just again is very little margin for error, and look, we're going to get through it. We're going to get through it with the same type of by sticking with the same type of things that have gotten us this far, which is everybody has to pull their own weight. There has to be teamwork. There has to be level-headedness about what we're doing. We will continue as a city government to put out information so that everybody understands what we're doing and why we're doing it, so that everyone can protect themselves and their family members. So with all that, I want to call up Patricia Andrade, Dr. Patricia Andrade, the chair of the New Bedford Board of Health, to say a few words about these orders. Patricia.
Thank you, Mayor Mitchell. So I just have a few points to make regarding this whole situation. Number one, as the Board of Health, our predominant role is to protect the health of the citizens of the city. And all of these measures that we're taking are very difficult to do, but they're necessary in order to achieve the goal of protection of health. Number two, I'll just reiterate a couple of things that the mayor said. Unfortunately, with this virus, there is no cure at this point. So the only cure is the power of each person has to socially distance. It's a difficult time. It's very frustrating, and people are going to lose patience. But we ask that you continue to hold that patience, because the longer that we stay isolated and keep to ourselves in social distance, the better control we can have of the dissemination of this disease. The city has done a really good job, and I think the citizens have done an excellent job. And we ask that we all are in this together, like they've been saying, are in this together. And it does take the continued persistence of every single individual staying home, keeping your hand washing your surfaces, and protecting yourself and seeking help when you really are ill. It's that simple. It's not simple. It's hard. This is really hard. It's hard economically. It's hard personally, but it's very important. It's the only way that we as a city can kind of keep this curve down and minimize dissemination. So we ask everyone to do their part. We as the board will continue to work with the mayor and the city to do whatever we have to do to protect our citizens. Thank you.
Thanks, Tricia. All right, thank you, Tricia. So I'm feeling raindrops, so let's get right to questions.
You mentioned the cases jump from 6 to 33. Has the Board of Health given you sort of a look at a trajectory that they should be expecting if testing improves, or is kind of this the sort of thing?
Yeah, it's so hard to tell. The disease transmission, at least in the early going, follows economic relationships as opposed to political boundaries. And so, I've mentioned publicly recently that, the countywide numbers that the state of Massachusetts gives out are not all that helpful in discerning where the virus is going. We're a different metro area from Providence, which is different from Boston. And so, you can see the epidemiological boundaries tend to track metro areas, right? And then if the horse really gets out of the barn, then it's all blurred. We don't want to get to that point. So we're not seeing the same level of cases as a lot of other places are, but it's hard to be definitive about how many cases we have presently, much less project when a supposed surge is going to come. All I can say with certainty is that the disease is here, it's spreading, and that the social distancing measures that we have adopted and are observing with a good deal of fealty have to remain in place. Hi, Kate.
That maybe some of the facilities are not taking the precautions that you need.
Yeah, so there are some places that are better capitalized than others, and have more in the way of resources. We're not seeing that now. We certainly have checked in with them, right, Damone? But we don't want to wait for a problem to materialize, Katie. So the answer is we're doing this preemptively in a way, and it's look, if we have to hold a fine over folks' head, it may never come to actually imposing a fine, but we can't mess around with it.
You previously closed down some senior centers a few years back.
Yeah, senior centers, which are in effect recreational. Yeah.
Is that the sort of thing now where you've seen success from that, and that's part of why we're seeing these measures now?
I think at some point we'll do one long post game on all of this and figure out where the right decisions were made or not. But I think doing that was sort of a no-brainer, and I don't think there's a senior center anywhere probably in the country that's still open. Certainly not in the Northeast. But these are things that we felt very strongly that we had to do. I see snow. I forgot that it's still snows. Yeah, it's not April Fool's Day. Yeah.
Do you have,
Jeanette.
do you have masks and gloves for the inspectors, and what's the status of the
Yeah.
masks
So
in general?
yeah. So not surprisingly, we're really short on equipment. We're starting to get shipments in. I don't have for you definitively today like exactly what we have on hand. All I can tell you is it's not nearly enough. We've submitted requests that greatly outsize, that greatly exceed, and I'll just give you some numbers, that greatly exceed what we're likely to get. So, we believe we need, not just for our first responders, but also for folks who are doing these inspections, as well as our medical providers. Roughly 20,000 N95 surgical masks in the next 60 days, 43,000 gloves, 8,000 aprons, and so forth. And we're not likely to get all that anytime soon, so we're conserving where we can. I know that we just got another shipment in recently, yesterday, of 1,000 N95 masks, but we'll go through those pretty quickly. And I know South Coast Health is getting those as well, but it's not nearly enough. I know that we have a number of our manufacturers who've retooled to us to start to to make some of this stuff. Places like Joseph Abboud and refried clothing. I know that, for instance, Precise is making O-rings for ventilators now. So, they're all, gearing up for the war effort, but it's not fast enough.
Have you seen any masks and things like of that nature coming through the federal stockpile or the federal government, or is that not really material?
It's getting passed through MEMA. Do you want to speak to that, Damon?
Yeah, our emergency management director will be handling our supply orders, and they're coming through MEMA, by way of MEMA through the city.
I guess I was curious if any of that stuff is originating with the federal government.
Yeah, I don't think so.
No.
I don't think so. I can't say definitively, but I think I would know that, and I think it has. All right. Anybody else?
Is there any indication that the hospitals in the area will get logistics?
Yeah. So I think there are a couple of issues there. So South Coast does not have the in-house ability to do testing. Some hospitals in some of the larger metro areas can. So some of the big Boston hospitals are doing it in-house and turning it around quickly. South Coast sends their tests to Quest Diagnostics as well as to the Massachusetts Department of Public Health. The turnaround times for those are much slower than they are for the in-house testing. The South Coast Health estimates that they're still a couple of weeks away from being able to do it in-house. And the in-house testing, I think, typically now allows for about a 24-hour turnaround. That's what we want to get to. You really can't. We all hear folks saying, when can you back off the social distancing and all the other painful measures? And the short answer is not anytime soon. The longer answer is you can't even start to consider that those backing off anything until you get a clear view that the cases are starting to not just decelerate, the spread is starting to decelerate, but the cases are actually starting to drop. And you can't get to that point until you have almost universal testing or largely universal testing of everybody who's symptomatic with a very quick turnaround time for those tests. Until you have that window, you can't even start to consider backing off.
Sort of separate note, but just because of the uniqueness of New Bedford, you guys have a ton of local businesses, local restaurants here, where plenty of cities have a lot of McDonald's and Chili's. Have you heard from the different restaurants how they're holding up with takeout only and things of that nature?
So some of them have closed down, right? So if you just walked around the block, you'd see some of the restaurants you guys are familiar with closed up right now, which is unfortunate. And some businesses are hanging in there with takeout. Even the ones that are doing just takeout have seen a drop in volume, and so nobody's at par right now. Everybody's hurting, and it stinks. It does. And look, this is what we're dealing with right now, and we're working with our federal and state authority, particularly the federal authorities, to make sure that they get the assistance they need. We've been working very closely with the Small Business Administration to make sure that small businesses in the region understand how they can gain access to low interest loans from the SBA. There may be some grant programs that follow. Maybe you've all heard about. In addition, the Congress is considering yet another round of stimulus. We're not holding our breath for that, but if that comes, that'll be helpful as well.
Have you heard anything further on that from, the congressional delegation with the aid specific to
Yeah. So in the bill that passed last week, Katie, didn't let's say this delicately. It didn't offer cities everything they hoped for. With many other mayors around the country, I had advocated for aid to be passed through the community development block grant structure. Cities like ours get CDBG funds. In our case, about $3 million a year. There's a eligibility structure in place that would allow for the passing of a lot of funds straight to cities. Congress decided that it was only going to do that for the 35 largest cities in America, the ones that have a population of over 500,000. So in New England, only one city qualifies. And so what that means is that we're not going to get money out as quickly to small businesses and to others in need as we could have. We're hopeful, of course, that the next round will allow for some direct funding to to municipalities, but we'll see.
Are you going to prevent people from congregating at parks or public places?
Yeah, just so everybody heard Josh's question. So he asked me about congregating at parks and other public places. So the police are enforcing it, and they've had to break up some basketball games. Unfortunately, we've had to resort to something that I hope we wouldn't have to do, but we have to do it. And that is, we took the rims down at most of the major basketball courts in the city, and including Buntwood Park, which is the mecca of basketball in southeastern Massachusetts. You have to do it. I mean, basketball is an unsafe sport right now. It is. If the kids don't accept that at face value, take a look at all the NBA players who've been infected, and that was way back in the beginning of March or April or February. So we've had to do that. We've had to break up a few games here and there, but by and large, New Bedford at least has been okay. We haven't seen, we certainly have seen lots of people walking around, and that's okay as long as you maintain some level of distance between the people you're walking with. But we haven't seen much in the way of basketball games. We've closed off a couple of parks. Pine Hill Acres Park is one example where we closed off the entire park. But I don't foresee closures of parks in general, because I think it's a pretty hard thing to enforce. We just have to be mindful that kids are playing games. The police might have to go in and break it up.
Do you have any numbers on unemployment spike?
We don't know. Prefer not to know. I'm sure it's unpleasant. We've seen literally hundreds of layoffs and furloughs just in the last 10 days at every manner of business. Small businesses have closed up. We've seen, factories like Joseph Abood and Titleist and a number of the others who have either furloughed everybody or furloughed substantially everybody. We've seen lots of others who've laid off people. Ahead is one of them. There are a number of others, and then we've seen, on our waterfront, the volume of fish has dropped off because of the closure of so many restaurants in the United States and Europe. And so today's April 1st. That means in New Bedford, not just April Fool's Day, but also the start of the scalloping season. And there aren't that many scallopers going out. So that's because of the drop in demand. So yeah, we're going to see huge unemployment numbers not too soon. All right. Thanks, everybody. We appreciate you're getting the word out.